Okay, let's unpack this. We're diving into a stack of sources today.
Mm-hmm.
Specifically, we've got excerpts from a briefing document and an article by Rob Stein.
Right.
And both pieces really zero in on a pretty significant and recent shift in federal health guidelines.
Yeah, seems like a big one.
So our mission in this deep dive is, well, to pull out the most important insights from only these sources we have here, understand the stated reasons behind this policy change, and kind of explore the immediate reactions and maybe potential implications.
Got it. Just what the sources say.
Exactly. So right off the bat, what was the core announcement reported across these sources? What's the big news here?
Well, the central piece of news, it's a major policy shift. The federal government has removed COVID-19 vaccine recommendations for healthy children and healthy pregnant women
Remove them from where?
from the CDC recommended immunization schedule.
Wow. Okay. That feels like a pretty significant change. Who was behind this announcement, according to the sources?
The sources report this decision was announced by Health and Human Services Secretary Robert F. Kennedy Jr.
Okay. And did they quote him?
They did. He was quoted saying, "I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule."
Couldn't be more pleased. That's strong language. What were the reasons given in the sources? Why make this specific change now?
The stated justification, as reported, it seemed to center on a perceived lack of data, specifically data supporting the continued recommendation for these groups.
For healthy kids and pregnant women.
Right. Secretary Kennedy is cited saying the decision was based on the lack of any clinical data to support the repeat booster strategy in children. And apparently he wasn't alone in this view from the government side.
Oh. Who else weighed in, according to the sources?
Well, the Food and Drug Administration Commissioner, Dr. Martin McCreary, he supported the move. He stated, there's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
Okay, so citing international precedent, too, it seems.
And also, the National Institutes of Health Director, Dr. Jay Bhattacharya, was quoted calling the decision common sense and it's good science.
Right. Now, here's where the sources point out something really kind of interesting about how this decision was actually reached.
Yes, this detail really stands out. They highlight that this decision was apparently made without the usual input from independent outside advisors.
Without the usual input.
Yeah. The sources specifically note that the CDC's Advisory Committee on Immunization Practices, ACIP, the group that typically makes recommendations on immunization schedules,
The expert panel.
they weren't actually scheduled to meet until later that month to even discuss this topic.
So the decision came before their scheduled meeting on it.
That's what the sources indicate, yeah. Outside the usual advisory process, it seems.
Okay, so we have a major policy change, specific justifications given about data, and this note about it happening outside the usual advisory process. What do the sources say is the most likely practical impact, for people, especially parents and pregnant people?
The sources point to a pretty significant consequence, potentially. They state it will likely make it much harder for parents and pregnant people to actually get these shots.
Harder how?
Well, the main reason cited is that insurance companies will likely no longer pay for them once the recommendation is removed from that official CDC schedule.
Ah, okay. So access becomes an issue because of cost, potentially.
That seems to be the direct link the sources are making.
And, as you might expect with a shift this significant, especially one maybe sidestepping the usual process, there was a strong reaction reported in the sources, right?
Oh, yeah.
What did the leading medical professional organizations have to say?
The reaction presented in the sources is one of, strong criticism and disappointment. Dr. Sean O'Leary, who chairs the American Academy of Pediatrics Committee on Infectious Diseases.
Okay, the Pediatricians group.
He expressed significant concern. He's quoted saying, it's really concerning, and I think it's going to be confusing not only for parents, but also for public health professionals and medical professionals as well. This takes away choice.
Takes away choice. Okay. And the sources also capture the response from the obstetrics and gynecology community, correct?
Yeah.
Since this involves pregnant women?
Absolutely. Dr. Stephen J. Fleischman, he's the president of the American College of Obstetricians and Gynecologists, ACOG.
Right.
He stated his organization was extremely disappointed. He really emphasized the ongoing dangers of COVID infection during pregnancy and also the risks for newborns who are, vulnerable.
Did they quote him directly on that?
Yes, his quote is quite direct. The science has not changed. It is very clear that COVID infection during pregnancy can be catastrophic and lead to major disability.
Catastrophic.
Wow. Yeah. And he also specifically highlighted the protection that maternal antibodies, passed from the mother to the baby through vaccination, offer newborns. That protection is key.
Okay, so a very different perspective there, focusing on unchanged science and risk. Just to put this reaction into context, the sources briefly touch on what the previous government stance was, right,
Yeah.
regarding these groups.
They do, yeah. The sources remind us that previously the government had recommended the shots pretty broadly. That included children and pregnant people.
And the reasoning back then.
The rationale then, as noted in the sources, was, well, that while children might not often get severely ill, some do, particularly very young children, and it was really emphasized that pregnant women faced high risks for serious complications.
Right, and the newborn protection aspect, too.
Exactly. Vaccinating them was seen as key to protecting their newborns, who are also at high risk.
Okay. And there was something about timing, too, wasn't there? Mentioned in the sources.
Yes, that's worth noting. This specific announcement, the one about healthy children and pregnant women, it followed just a week after other changes were made. Changes to the overall COVID booster strategy.
What kind of changes?
The sources say those earlier changes now require additional testing for future boosters and could potentially restrict future boosters mainly to high-risk individuals, like those aged 65 plus or people with certain underlying conditions.
Interesting timing, then. One change potentially narrowing booster access, followed by this removal of the recommendation for other groups.
Seems linked based on the timeline in the sources.
So amidst this swift policy change, the noted process issues, and this really strong pushback from medical groups, was there any final word from HHS included in the sources? Any official kind of reassurance?
Yes, the sources do include a statement from the HHS press secretary, Bianca N. Rodriguez Feliciano.
And what did that say?
It asserted, quote, HHS and the CDC remain committed to gold standard science and to ensuring the health and well-being of all Americans, especially our nation's children.
Gold standard science.
Okay.
So pulling all of this together from the sources we have, the announcement, the stated reasons focusing on data perceived as insufficient for boosters in kids.
Right, the lack of clinical data justification.
Then the bypassing of the usual advisory committee process, the resulting likely loss of insurance coverage, creating these barriers to access.
Yeah, the practical impact.
And then